Hello and a warm welcome to the video session of Rare Case Presentation. I am Dr. Smell-Bell-Verbal SBV Chandrasekhar from Hyderabad. My topic is piezoelectric drill a better option for fibrous dysplasia of maxilla? Fibrous dysplasia is a slow growing tumor, as we know, like a lesion of a bone, wherein the normal cancellous bone is replaced by abnormal fibrous tissue. It can be a part of simple presentation or a part of a syndrome. It is much common before 30 years of age, and CT and MRI help in the diagnosis, with CT showing the ground glass appearance, and risk of malignant transformation is 0.5% into osteosarcoma. They cause cosmetic deformity and can be controlled by resection and recontouring. We have a 10-year-old female presenting with swelling over the cheek on the left side of the maxillary region. This is the CT scan picture. As you could see over here, in this particular thing, you are finding a lesion in front of the left maxilla in this region, not disturbing the orbit. These were the coronal cuts, and it was not involving any sinus region, and you are able to see that sinuses are free. It is just in front of the left maxilla. We ruled out other regions by taking the x-rays of the skull and also other bone lesions if they are found. Fortunately, they were not there. We have investigated and diagnosed it as fibrous dysplasia, wherein we had differential diagnoses like ossifying fibroma, cementoblastoma, osteoma, and osteosarcoma. We decided to excise the lesion. The surgery we did was superficial osteectomy of the maxilla, wherein sublabial approach was selected, and this was the excised specimen. We used the piezoelectric effect for drilling the tissue, and we did the osteectomy of the maxilla with minimal collateral damage and got maximum benefit based on the cosmosis. Now let us see what is the advantage of piezoelectric drill. And before that, let me show the pre-op picture and post-op pictures day 2, day 7, and how the cosmosis was attained. These were the histopathology pictures which confirm the fibrous dysplasia. As you could see here, the fibrous component is more. Based on discussion, we can have different types of fibrous dysplasia like monoosteotic variety, polyosteotic variety, and craniofacial variety. And this is because of a mutated gene called as GNAS, which increases the CAMP, and we have got osteoblast, impaired differentiation, and increased melanocyte production leading to coagulate spots, and endocrine dysfunction leading to a syndrome called Jaffe-Lichtenstein syndrome. This melanocyte leads to McCune-Albright syndrome, and only bony lesion leads to fibrous dysplasia. And sometimes there can be leonine phases like leishmaniasis osseosa. But my point of discussion is the utility of a piezoelectric drill, how it is going to work. Let us see. Fibrous dysplasia growth, left side of the nose with cautery, protected cautery. Marks are being done so that mucosal injury is prevented. The next elevation being done with the periosteal elevation. Subperiosteal.
Okay, we can go easily. See, and you can see the nerve clearly, which is coming out from the infraorbital nerve.
Okay.
Foramen.
Okay. Excellent.
This is the nerve. Okay, be careful. The particular once we have to place indentations with the bone. Okay, with the bud on the bone.
Okay.
Then we'll
For the nose. Yes. Piriform.
Okay,
Little bit nearby.
Electric effect.
Take a picture. Ultrasonic vibration.
Okay, sir.
And whenever it comes in contact with the surface, it will stop by itself.
Can you brief about the mechanism of cutting, sir, in this?
It's based on ultrasonic vibration.
Okay, sir.
It will come.
Okay, sir.
If you do this, parallel.
Yeah. Collateral damage, you mean to say.
Cavities, right?
Okay.
So,
Coal mine.
contain vision and all.
Fibers are seen. Yeah. Picture. Nerve is being surrounded by the trying to retract the infraorbital, no? We demonstrated that. The infraorbital now. We demonstrated that. Bring the infraorbital now. So this is a post-op endoscopic view which are showing the defect and suction being done. 30. The continuous interlocking switches is being put.
Piezoelectricity is the generation of electric charge in a substance by applying a mechanical pressure. That means if we squeeze certain materials, including some types of crystal and ceramic, and biological matter such as bone, DNA, and some proteins, we'll produce charge. Piezo comes from the Greek pizine, which means to squeeze or press. The piezoelectric effect was discovered by French physicists Jacques and Pierre Curie in 1880. Commonly used piezo crystal is quartz, which consists of a lattice of silicon and oxygen. In 1881, inverse piezoelectricity was discovered. This is the opposite effect. By supplying electricity to a piezo crystal, we cause the crystal to change shape slightly, which means we can generate sound waves from piezo crystals. In 1917 came the first practical application of piezoelectricity. It was used as part
what
of a
are the
sonar
advantages
system
of
for
piezo
detecting
drill?
submarines.
Let us see.
It's used in medical devices.
Surgery unit, when the unit is on, the water or the coolant is flowing on the tip, so it is interacting with the solid, and liquid is interact as we seen in the slide, and there will be a micro air droplets mixing with the air till they are about to explode, and this cause the pressure within the area. When they burst, they cause momentary homeostasis on the surgical site, and because they are bombarding with pressure, they clean up. Whenever this piezoelectric material is charged, the vibration at the tip is between 60 to 200 micrometers, so that cut precisely and does not go beyond that, so you can control that cut. And as we can see in the figure 304 and 305, in 303 there is slight brownish or blackish discoloration, and we all know brown or black is a color of necrosis. That happens when we use bone bars or bone saw. With piezo, our temperature never rise, we cannot apply much pressure. Why
Thus,
we cannot,
could
that will
find
discuss
the
later on.
distinct
Piezo surgery is
advantage
a
of
blood
piezo
free
drill when
surgery.
compared to regular drill. Thank you very much for the patient listening.